Hello, I am John Fetting, a breast cancer medical oncologist in the Breast and GYN Malignancies Program at the Hopkins Kimmel Cancer Center. Earlier this year, the Surgeon General of the United States issued an advisory on alcohol as a cause, not the only cause, but a cause, of 7 cancers, including breast cancer. Breast cancer patients of the Breast and GYN Malignancies Program at Hopkins have asked our staff what this means for them. Is alcohol safe? In response to questions from our breast cancer patients, we prepared 2 PowerPoint presentations. The first is a brief summary of the Surgeon General's advisory with a special focus on breast cancer. Of note, and this is very important, the advisory does not address alcohol in women who have had breast cancer. As a result of that, and because of the questions we were getting from our patients, we developed a second PowerPoint presentation which summarizes what we know about alcohol in women who have had breast cancer. And this presentation also includes advice on drinking alcohol after a diagnosis of breast cancer. With this by way of introduction, let's start with a brief summary of the Surgeon General's advisory on alcohol and cancer risk, focusing on alcohol and breast cancer. Alcohol is one of a number of risk factors for breast cancer. There are many others, but they include some that you may know about already, including BRCA mutations, family history, extreme breast density, and as I said, there are others. Some risk factors increase the chance of getting breast cancer a lot. They are strong risk factors. Other risk factors increase the chance of getting breast cancer only a small amount. They are weak or modest risk factors. Drinking alcohol increases the chance of getting breast cancer by a small amount compared to a woman who does not drink. Alcohol is a modifiable risk factor. The less you drink, the lower your risk. Conversely, the more you drink, the higher your risk. Some risk factors are not modifiable. An example of a risk factor that's not modifiable would be a family history of breast cancer. It's not something you can do much about. You are born with it. Alcohol is not only a risk factor for breast cancer, but also a cause of breast cancer. Alcohol causes DNA damage, which leads to cancer. Other risk factors increase the chance of getting breast cancer, but we don't know how they cause it. Whereas for alcohol, we know it's a risk factor and we know how it causes cancer. Other risk factors, we know it increases the risk, but we're not sure what the mechanism is for a cause. The risk posed by alcohol can be expressed in 2 ways: absolute risk and relative risk. Absolute and relative risk express risk differently. Absolute risk is the percentage chance that an individual will develop breast cancer over a defined period of time. For example, 1 woman in 8, or 12.5%, will develop breast cancer in her lifetime. This is an expression of absolute risk. This is the best way for doctors and patients to talk about risk. This is the best way for a doctor to inform a patient who wants to know about her breast cancer risk. Relative risk is another way of expressing risk. It is a ratio. It is the percentage chance of a woman with a risk factor getting breast cancer over the percentage chance of a woman without this risk factor getting breast cancer. Relative risk is a good way to indicate the strength of a risk factor. This graph is very important, very important. It is busy, so I am going to go over it slowly with the hope that this will help you understand it better. The graph depicts the absolute risk of developing breast cancer from 0 to 100% on this vertical axis for 3 levels of drinking alcohol. And these are expressed on this horizontal axis. And the 3 levels of drinking are less than 1 drink per week, 1 drink per day, and 2 drinks per day. Note that the risk increases from 11.3% to 13.1% to 15.3% as the amount of alcohol increases from less than 1 drink per week to 1 drink per day to 2 drinks per day. Note the upward sweep of this arrow indicating that the risk is rising as the amount of alcohol consumed increases. However, note that the risk does not increase by much, rising just 4% as a result of drinking 2 drinks per day. 11.3 to 13.1 to 15.3, that's 4%. And that's 15.3% lifetime risk for people who are drinking 2 drinks per day. Said another way, this means that 4 more women out of 100 who drink 2 drinks per day will develop breast cancer. Note that breast cancer risk remains at the lower end of the vertical axis. So we're only up to 15%, and the axis goes all the way up to 100. So these numbers of breast cancer risk related to drinking are at the lower end of the spectrum. What does this mean? It means that alcohol is not a strong risk factor, but it also means that alcohol's risk is dose related, even though it's not strong at any level. As you go from less than 1 drink per week to 1 drink per day to 2 drinks per day, the risk goes up. It's dose related. Well, as risk factors go, how does alcohol stack up? This slide compares the absolute risk of 5 breast cancer risk factors as a way of comparing the strength of each risk factor. The lifetime absolute risk of developing breast cancer with no known risk factors is 11.3%. If one drinks 2 drinks per day, the risk is 15.3%. Postmenopausal obesity, another risk factor for breast cancer, increases the risk modestly to 14 to 18%. Women with 1 first-degree relative with breast cancer have a more significant increase in lifetime risk to 24%. Women with extreme breast density on their mammogram have a lifetime risk of 25 to 29%. And a BRCA mutation has a much higher lifetime risk of somewhere between 45 and 80%. This comparison points out that alcohol is really a modest risk factor compared to others. The advisory included the U.S. dietary guidelines on upper limits on drinking for men and for women, upper limits of drinking daily. And for men, it is 2 standard drinks per day, and for women, 1 standard drink per day. The lower limit for women is because alcohol produces higher blood levels in women than men for the same amount of alcohol consumed. The advisory defines a standard drink. It is 5 ounces of wine, 12 ounces of beer, or 0.6 of an ounce of hard liquor. Standardizing the amount helps consistency across research studies and also in communication amongst investigators, but also between doctors and patients when they talk about how much a patient is drinking. This final point is really worth noting and very important. 83 or just above 80% of alcohol-related cancer deaths occur in drinkers who exceed these guidelines. 80+% of alcohol-related cancer deaths occur in drinkers who exceed these guidelines. Continuing on with the summary of the advisory, the Surgeon General highlights the impact of alcohol on the U.S. population by pointing out that alcohol is a cause of 100,000 cancer cases and 20,000 cancer deaths per year. Highlighting an education gap, the advisory notes that although 70% of U.S. adults consume one or more drinks per week, less than half are aware of the relationship between alcohol and cancer. This is the Surgeon General's call to action. These are steps the Surgeon General recommends that we take now. The Surgeon General recommends that we update warning labels on alcohol to include cancer. Currently, the labels warn about alcohol and driving and alcohol and pregnancy. The Surgeon General feels like we have enough evidence that alcohol can cause cancer that it should be on a warning label. The Surgeon General also suggests that we reassess the recommended daily limits to account for the latest evidence on alcohol and cancer risk. The Surgeon General, I suppose, is suggesting that these limits will come down. It's recommended that we expand education on alcohol and cancer risk and incorporate alcohol reduction strategies into population-level cancer prevention plans. And finally, there's a call to action for doctors and patients in that doctors and patients should review what patients are drinking in light of what we now know about alcohol and cancer risk. Let me close by acknowledging the Fetting Fund, which supports translational breast cancer prevention research conducted by the faculty of the Breast and Gynecologic Malignancies Program at the Hopkins Kimmel Cancer Center. The Fetting Fund is supported by donations from breast cancer patients, their families, their friends, and supporters of breast cancer prevention research. The fund's research focus starts with the understanding that 1 in 8 women will develop breast cancer in her lifetime, but currently we do not know who she is until she is diagnosed. The Fetting Fund supports research aimed at identifying the 1 in 8 before she develops breast cancer so that she can receive intensified screening and prevention efforts. Scan this QR code or go to www.fettingfund.org to connect with the Fetting Fund website, where you can hear from women who did not know that they were the 1 in 8, and where you can learn more about the work of the Fetting Fund. If you have any questions or comments about this presentation, let me suggest that you send them to Jocelyn Cantor at this email address. Jocelyn will pass them on to me, and I will do my very best to answer them for you. Thank you very much for your attention.